If you clicked on this video because of the title, then you are exactly in the right place. And I want you to stay with me until the very end, because what I'm about to share with you could genuinely change your life. Your feet are talking to you right now. Every single day they are sending you messages, quiet little signals, trying to warn you that something is going wrong deep inside your body. But most people completely ignore these messages. They think, oh, it is just tiredness. Oh, it is just old age. Oh, it is nothing serious. But here's the truth. Those little signs in your feet, they are not nothing. They could be the earliest warning your body gives you before diabetes takes hold. And once diabetes takes hold without you knowing, it starts doing damage that is very, very hard to reverse. My name is Dr. Michael, and I have been practicing medicine for over 20 years. In all those years, I have sat across from thousands of patients. Good, hardworking people who came to me too late, not because they did not care about their health, but because nobody ever told them what to look for. I remember one patient very clearly. Her name was Margaret. She was 67 years old, a grandmother. She came to me complaining about her shoes feeling tight and her feet feeling strange at night. She thought it was just her shoes getting old. We ran some tests, and I had to tell her that she had had uncontrolled blood sugar for probably 3 or 4 years already. 3 or 4 years of silent damage. And she had no idea. Here is the number that should wake every single person up. The American Diabetes Association estimates that around 8 million Americans are living with diabetes right now, and they do not know it. They have not been diagnosed. They are going about their daily lives while their body is slowly being damaged from the inside. Today, I am going to show you exactly the 9 warning signs in your feet that could mean diabetes, so you never have to worry about missing them again. These are real signs, simple signs. Signs you can check yourself right now sitting in your chair. Let us get into it. The first sign I want you to think about is numbness or tingling in your feet. Now, most people feel this and they think, oh, I was just sitting in a funny position. Or maybe my circulation is a little slow today. They shake their foot around for a few seconds and forget about it. But let me tell you what is actually happening inside the body when blood sugar stays too high for too long. Your blood is like a delivery truck. It carries oxygen and nutrients to every part of your body, including the tiny little nerves in your feet. When there is too much sugar in your blood, it is like throwing sand into the engine of that delivery truck. The truck slows down. The deliveries stop reaching the far ends of the route. And the nerves in your feet, they are at the very end of that route. They are the last stop, so they are the first ones to suffer. This damage to the nerves is called peripheral neuropathy, but do not worry about that word. Just think of it as your foot nerves sending out a distress signal. That tingling, that numbness, that is your nerve saying, I am not getting what I need. Studies show that more than 50% of people with diabetes will develop some form of nerve damage in their lifetime. And the scary part is, it often starts in the feet years before a diagnosis. One simple habit you can start today. Every evening, sit down and gently rub the soles of your feet with your hands. Pay attention to whether both feet feel the same. If one area feels duller, less sensitive, or different from yesterday, write it down. Notice it. Do not just ignore it. The second sign is burning pain, especially at night. This one confuses a lot of people because they expect pain to mean something obvious is wrong, like a cut or a bruise. But this kind of pain is different. It is a deep, burning, aching pain, sometimes described as walking on hot sand, and it often gets worse at night when you are lying in bed trying to sleep. Here is what is happening. When those nerves start getting damaged, they do not just go quiet. Sometimes they start misfiring. Think of it like an old electrical wire in the walls of a house. When the insulation starts to wear away, the wire does not just stop working. It starts sparking, sending random signals. That burning sensation, that is your nerve sparking, sending false fire alarms to your brain. I see this in my clinic every single week. Patients who tell me they cannot sleep because of the burning in their feet. And when we do blood work, the blood sugar tells the whole story. The American Academy of Neurology confirms that burning foot pain is one of the most common early symptoms of diabetic nerve damage. And the earlier you catch it, the better the outcome. A simple habit for this one. Before bed, keep a small journal next to your bed, just a notebook. If you feel burning in your feet while lying down, write it down. How strong is it on a scale of 1 to 10? Which foot? Is it getting better or worse over days? This information is gold when you talk to your doctor. It helps them understand exactly what your body is doing. Let me pause here and ask you something. Have you ever woken up at night because of strange sensations in your feet? Maybe you thought it was the blanket or the temperature in the room. I want you to really think about that. Because that moment of waking up, your body was trying to tell you something. The third sign is swelling in the feet and ankles. Now, swelling is one of those things people really love to explain away. Oh, I was on my feet all day. Oh, it is hot outside. Oh, I ate too much salt. And yes, Sometimes those things do cause swelling, but there is a specific kind of swelling that is connected to high blood sugar, and it has certain patterns that are different. When blood sugar stays high over time, it starts damaging the tiny blood vessels throughout the body. The kidneys are particularly vulnerable, and when the kidneys start struggling, they stop filtering fluid properly. That fluid then starts to leak out and collect in the lowest parts of the body, which are your feet and ankles. Think of your kidney like a drain in a sink. When the drain is clear, water flows freely. When the drain gets clogged, water starts pooling up. Your feet and ankles are where that pool forms first. Research published in the journal Diabetes Care shows that kidney complications from uncontrolled blood sugar can begin silently, often showing up first as ankle swelling before any other symptom appears. A simple habit. Every morning before you put your socks on, press your thumb gently into the skin just above your ankle bone for 5 seconds, then release. If the dent stays, if the skin does not spring back immediately, that is called pitting edema, and you should tell your doctor about it. Do not ignore it. The fourth sign is very dry and cracked skin on the feet. You might look at your heels and think, oh, that is just from not moisturizing enough, or my shoes are too stiff. But here is something most people do not realize. High blood sugar causes the body to lose more fluid than normal. The body is constantly trying to flush out excess sugar through urination. And all that fluid loss, it dries out the skin, especially the skin on the feet. At the same time, nerve damage can affect the small glands in the skin that produce natural oils. So you lose moisture from 2 directions at once. The result is skin that becomes extremely dry, thick, and cracked. And those cracks, especially on the heels, they are not just cosmetic. They are open doors for infection. And in a person with diabetes, infections in the feet can become very serious, very fast. The simple habit here: apply a thick, fragrance-free moisturizing cream to the soles and heels of your feet every single night before bed. Not between the toes, because that can trap moisture and cause a different problem, but everywhere else. This is one of the most protective things you can do for your feet. The fifth sign is slow-healing cuts or sores. This is one that I consider a very serious warning sign, and I want you to really listen carefully here. If you get a small cut on your foot, or a blister from your shoe, or a little scrape from something on the ground, and it takes weeks and weeks to heal, that is not normal. That is your body telling you that something is wrong. Here is why this happens. High blood sugar thickens the blood and damages blood vessels. That means the blood that carries healing cells, immune cells, nutrients, and oxygen to a wound. It moves slowly. The healing supply line is blocked. And in the feet, which are already the farthest point from the heart, this problem is even worse. I had another patient, a man named Robert. He was 71. He got a small blister on the side of his foot from a new pair of shoes. Normally, something like that heals in a week. For Robert, it was still open after 6 weeks. That was actually how we discovered his diabetes. That one small wound told the whole story. The American Diabetes Association warns that foot ulcers and slow-healing wounds are among the leading causes of hospitalization in people with diabetes. Catching this early is absolutely critical. Simple habit. After every shower or bath, dry your feet completely and take 30 seconds to look at the bottom of your feet and between your toes. Use a small mirror if you cannot bend easily. Look for any sores, cuts, blisters, or red areas that were not there before. Early spotting saves lives. If you are watching this and any of these signs sound familiar to you, type yes in the comments right now. I personally read every single comment on this channel. I want to know how many of you are recognizing these signs in yourself or someone you love. Type yes right now. The sixth sign is changes in skin color on the feet. This one is subtle but very telling. Some people notice that their feet start looking redder than usual when hanging down, or they look pale or almost bluish when elevated. Others notice dark, velvety patches of skin forming around the ankles or on the sides of the feet. These color changes are all messages from your circulation system. When blood vessels are damaged by high sugar, blood flow becomes inconsistent. In some areas, there is too much pooling. In others, there is not enough blood reaching the skin at all. The result is these color patches and shifts that come and go or that slowly worsen over time. That dark velvety patch I mentioned, it has a name, acanthosis nigricans, but again, do not worry about the word. Just know that it is a very common visible sign that insulin is not working properly in the body. It often appears before a diabetes diagnosis is even made. A study in the Journal of Clinical Endocrinology found that this kind of skin darkening is present in a significant percentage of people with prediabetes and type 2 diabetes, often for years before diagnosis. Simple habit here. Once a week, look at both feet in good natural light. Compare the color, compare to how they looked a few weeks ago. If you notice new dark patches or persistent redness or paleness that does not go away after warming up, mention it to your doctor at your next visit. Take a photo on your phone so you have a record. Let me pause here again and ask you something. When was the last time you really looked at your feet? I mean, really looked. Turned them over, checked between the toes, looked at the color and the texture. Most people never do this, and I understand it can be hard to bend that way. But your feet are carrying incredible information about your internal health. They deserve a few seconds of your attention every day. The seventh sign is hair loss on the toes and lower legs. This one surprises almost everybody. People do not usually connect hair loss on their toes with blood sugar. But when blood circulation to the lower legs and feet is reduced because of damaged blood vessels, one of the first things that happens is the hair follicles in that area stop receiving enough nourishment, and they stop producing hair. Think of it like a garden. If you stop watering a section of your garden, the plants in that section start to die first. The hair on the toes and lower legs is like those plants. When the circulation water stops flowing properly, that hair disappears. If you look at your lower legs and toes and you notice that the hair is significantly thinner or completely gone compared to your upper legs, and you are not sure when that happened, it is worth mentioning to your doctor. A simple habit. When you are in the shower, pay attention to how your lower legs feel under the water. If the water feels less warm or less intense on your feet compared to your upper body, that is another gentle hint that circulation may be reduced. Note it down. The eighth sign is foot pain or cramping when walking. Some people notice that after walking for just a short distance, they get a deep cramping or aching pain in the foot or the calf. And interestingly, when they stop and rest for a few minutes, it goes away. Then they walk again and it comes back. This pattern has a name, intermittent claudication. But again, let us keep it simple. What this is telling you is that the blood vessels carrying blood to the muscles of your legs and feet are narrowed. So when you start walking and your muscles need more blood and oxygen, the narrowed vessels cannot deliver enough. The muscles start to cramp and protest. When you rest, the demand drops and the cramping eases. This is a form of peripheral artery disease which is very closely linked to diabetes and high blood sugar. Studies show that people with diabetes are up to 4 times more likely to develop this kind of poor circulation in the legs compared to people without diabetes. The habit here. Do not stop walking just because it causes this discomfort. Gentle, regular walking actually helps train the blood vessels to work more efficiently over time. Start with short walks, 5 or 10 minutes, rest when needed, then go again. This is called interval walking, and it is one of the most powerful free tools for improving circulation in the legs and feet. The ninth and final sign I want to talk about today is a change in the shape of the foot or toes. This is one that develops slowly and quietly. Over time, nerve damage can affect the small muscles inside the foot that hold everything in proper alignment. When those muscles weaken, the toes can start to curl or claw. The arch of the foot may flatten or change. Bony bumps may appear. The foot slowly reshapes itself. This happens because the muscles that used to hold things in balance are no longer receiving the right nerve signals. So they weaken, and the tendons and ligaments pull the bones into new positions. This can happen gradually over years, so gradually that people barely notice until their shoes suddenly feel wrong or they develop calluses in new places. Here is the important thing to understand. A changed foot shape creates new pressure points. Those new pressure points create sores and calluses. Those sores in a person with damaged circulation and weakened immunity from high blood sugar, they become dangerous very quickly. A simple habit. When you buy new shoes, always have your foot properly measured. Feet change shape as we age, and especially when nerve or circulation changes occur. Wearing shoes that no longer fit properly is one of the leading causes of foot wounds in people with diabetes or prediabetes. Never buy shoes online without trying them first, and always make sure there is a little space at the front, about the width of your thumb, between the end of your longest toe and the front of the shoe. Now, I have walked you through all 9 warning signs, and if even 2 or 3 of them rang a bell for you today, I want you to take that seriously, because here is the truth that I want you to really hold on to. Diabetes does not have to be a life sentence. Prediabetes can be reversed. Early diabetes can be managed so well that the damage stops and sometimes even heals, but only if you act early. So here is the complete, simple plan I want you to follow starting this week. Write these down if you can. First, check your blood sugar. If you have not had your blood sugar tested in the last year, please call your doctor's office tomorrow morning and ask for a simple fasting blood sugar test or an HbA1c test. These are basic, inexpensive, and available everywhere. The HbA1c test gives your doctor a picture of your average blood sugar over the last 3 months. It is the gold standard for catching diabetes and prediabetes early. Do not put this off. Second, clean up your plate starting tonight. You do not need a complicated diet. You just need to make 2 simple swaps. Replace white bread, white rice, and white pasta with whole grain versions. And cut sugary drinks completely. Just water, plain tea, and black coffee. These 2 changes alone can have a significant impact on blood sugar within weeks. Studies at Harvard Medical School have shown that replacing refined carbohydrates with whole grains reduces the risk of type 2 diabetes by up to 30%.